Thank you for joining us for the St. Louis Metropolitan Pandemic Task Force Daily Briefing with Dr. Alex Garza. The briefing will begin shortly. Dr. Garza will take questions that have been submitted by members of the media after he makes brief remarks. Reporters who have questions during the briefing may also submit those to the Task Force Public Information contacts, and we will attempt to address those during the briefing or as quickly as possible after it concludes. I'll now turn the briefing over to Dr. Alex Garza. Thank you.
Okay, thank you and good afternoon, everybody. I hope you were able to have a nice weekend and relax a bit in some of this great weather. I was able to take a break from work and help my sons build a garden, so that was fun. So here are the updates that we have today. And again, these are all from our task force member facilities here in the St. Louis metropolitan area that cover BJC Healthcare, Mercy, SSM Health, and St. Luke's Hospital. So this is where we are standing today. And remember, these are cases of COVID positive and those that are under investigation for COVID. So we're waiting for test results to come back. Now, as of today, you can see that we have 757 hospitalizations, which is up from yesterday, where we had 659. So quite a jump. We're significantly higher than where we stood when we started displaying this data 2 weeks ago. There are also 196 ICU patients, which is up from 173 yesterday. 142 patients are on ventilators today, and this is around the same number as we had yesterday, which was 139. And finally, the good news, today we had another 26 COVID patients that were discharged from our hospitals yesterday. So as you can see, we've had some important progress in stopping the spread of the virus, but we still have quite a significant number of people that are hospitalized. And as I've reiterated, we continue to be on that steep part of the curve, and our modeling has told us that we are not quite at our peak dates yet. And as of today, our hospitalizations are up more than 60% from where we first started in early April. So even though many people are going home each week, more people are still being infected and hospitalized, and the virus is continuing to spread. And as I've mentioned in the past, the curve will rise and will fall gradually. So this isn't like a mountain peak. This is more of a gentle rolling hill. And so we're going to see sustained numbers for a period of time before they really start decreasing. And this is a contagious virus, and so steps that people have taken to decrease the amount of spread really need to continue. And so those are stay at home, keep washing your hands, continue to keep surfaces clean, practice social distancing, and decrease the spread. And so with that, I'm going to go ahead and take questions from the media.
Can you explain the role antibody testing might play locally in order to return to a so-called new normal? Do you anticipate a widespread test in the near future to determine and identify those people who can move in the community without fear of becoming infected?
So a couple different questions in there. So antibody testing is being validated right now. So you've heard me say before that there are some companies that are advertising for antibody testing that we have to be very careful of the claims that they are making. So some of them have not been approved by the FDA and have not been validated by other labs. And so you have to be really careful about that. The other piece is just because you have a positive test from immunity testing, that doesn't describe the level of immunity that you have. And so it would be a false assumption to say that just because you have a positive antibody test, that you are completely immune to the virus. So we don't know what the level of antibody is when we do these tests, nor do we know enough about the virus to understand the level of protection that then imparts on a person. So it's also misleading to say if you have a positive test that you can move freely around society without any limitations. We just don't know that much about what that test means. So, and then the third part, yes, we are building that into our plans for how we can do what's called prevalence testing in the community. And what that really shows us is the number of people within our community that have been exposed to the virus. It doesn't tell us the level of immunity, but at least it gives us a number of people that have been exposed and that have contracted the virus.
We've received a few questions regarding a planned protest tomorrow at the Missouri State Capitol in Jefferson City. It's being described as a protest to reopen Missouri. The group is calling for a reopening of the economy while still protecting the state's more vulnerable populations. Do you have any message to the group that is planning this rally tomorrow? And does the state have enough testing capacity right now to make reopening the economy possible?
So I'm not sure if I have a message for the people in particular. Let me tell you, though, about what we need to be planning for. So the challenge is, as I've said multiple times, is opening too fast, too soon. And the reasons for that are pretty clear, and we've seen examples of this in the past, where if you move to open up the shelter-in-place and social distancing rules too fast, you can actually create a second wave, which can be worse than the first wave. And so and I recognize that it's challenging. I mean, people want to get out and enjoy the weather and go back to work and all of these things. But we have to think of the broader picture, which is decreasing the risk of transmission, which decreases the number of infections, which decreases the number of deaths. These all fit together into a chain, and so you can't do one without impacting the others. Now, as far as the testing for the state goes, we're still challenged, us as healthcare systems, and I'm sure that the state would agree that we're still challenged with the number of testing kits that we have available to us in order to do really robust testing for the population. As I've mentioned before, there's two separate types of testing. One is for surveillance in the community, and one is for diagnosis. The ones that we have for diagnosis, we feel fairly confident that we have the supplies for that. It's that surveillance piece which we need to be robust if we want to open up the economy that we need to really bolster.
Can you explain the difference between the new Institute for Health Metrics and Evaluation data from the University of Washington released on Friday, which say that St. Louis already hit its peak, and the numbers from the model the task force is using, which show that the peak is still coming toward the end of this week?
Sure. So I'll go back to my old adage of all models are wrong and some are useful. And so when you look at the IHME models and the models that we're using, there are two different types of models. So if the IHME predicted the peak earlier in this week or last week, and we're predicting it later this week, even given a span of 7 days for models like these is not terribly disconcerting. But again, as you've seen from our data, ours is tracking pretty well with our best case data, and so we're really confident in the model that we're using. It's just a different type of model that IHME uses.
Do you have any statistics on the number of employees of task force member health systems who have tested positive? There was a statistic out of the Illinois Department of Public Health on Friday saying that 45% of those who have tested positive in the state listed their occupation as a healthcare worker. However, that's constrained because the state only knows the occupation for a fraction of the total number of positive cases. Any data you can share from here locally?
So we don't have coordinated data between our healthcare systems, but we're collecting it right now. And so we should have an answer for you about how this is impacting healthcare workers, within a short amount of time. What I can say is it's a little bit confusing as well when you start looking at the data when you're considering the entirety of healthcare workers. So of course we can gather data on our employees that work in the healthcare systems, but there's still a substantial number of people that are healthcare workers that work outside of our healthcare systems, and so those are people like home health aides or nursing assistants that work in nursing homes and a significant portion of other healthcare workers. So the data that we'll give you is the data that is from our healthcare systems, and so it'll be a good approximation, but it won't tell the whole story.
Thank you. That concludes the list of questions received from members of the media prior to and during today's briefing. In the morning, we'll accept questions from members of the media for tomorrow afternoon's live stream. Thank you for tuning in.